SRR channel. Today our topic is infection, classification of infection and the sources of the infection. Let's go. First of all, the definition of infection. The lodgement and multiplication of a pathogen in the tissue of the host is termed as infection. Means the tissue of the host, the pathogen will lodge and it will multiply. That is known as infection. All infections do not invariably result in the disease. Some remain asymptomatic and other may lead to S and S. One S remains the signs and other S remains the symptoms. Classification. Mainly the classification of the infection depends upon the three. We will remain as time, source, clinical. Time of infection, source of infection and clinical effects of infection. Now we will go with time of infection. Time of infection. In time of infection there are mainly three: primary infection, reinfection, secondary infection. Primary infection is nothing but initial infection with a pathogen. Reinfection is subsequent infection by the same pathogen. Secondary infection is new pathogen enters host whose resistance is lowered by an older infectious disease. Cross infection. In a patient who is already suffering from a disease, a new infection is set up from another host or external source. It is known as cross infection. Means the patient is already suffering from other disease and a new pathogen will again set up in the body. Then it is known as cross infection. Nosocomial infection. Cross infection which are acquiring at the hospital is known as nosocomial infection. Means nothing but the kind of cross infections which are acquiring in the hospital is known as nosocomial infection. Heterogenic infection. It is a physical induced infection by contaminated syringes and laboratory instruments. Means normally while physicians, the surgeons, while during a surgery, an instrument sometimes may be due to an not properly sterilized or some reasons, some of the infectious agents may be present on the instruments and they may cause like some of the infectious diseases in them. That kind of infections we will call as heterogenic infection. Now we will go to source of infection. Under the source of infection, the infections are endogenous and exogenous. Exogenous means nothing but from the external sources. Endogenous is nothing but from the host own's body. And clinical effects of infection. Mainly inapparent infection, atypical infection, latent infection. Inapparent infection means clinical effects are not apparent. Atypical infection means characteristic manifestation of a particular disease will be absent. Atypical infection we can say like the characteristic symptom means if a person is suffering from fever, cough, chills, we can't like nowadays we can't say with this kind of symptoms what is the main suffering of the person. So this kind of situation like we can't like particular disease is absent means nowadays we are the physician can't able to identify what is the main disease like symptoms based on the symptom fever, cough and chills. That is known as atypical infection. Latent infection. Parasite remain hidden from and produce the symptoms. It is known as latent infection. Now we had completed the classification. Once again we will remind classification under time, classification under the source, classification under the clinical effects. Now we will go to the source of infection. The person, animal, object or substance from which an infection agent passes to the host. They are human, animal, insect, soil and water, food. First we will start with human. Human source. The parasite may originate from the patient or carrier. In human source, The carriers are classified as healthy carrier, means nothing but has no suffering, but he will carry the pathogen. Convalescent carrier, one who has recovered but still harbors the pathogen in his body, is known as convalescent carrier. Temporary carrier, having the pathogen for less than 6 months, known as temporary carrier. Chronic carrier, lasts for several years or for long time. Any situation, chronic means it's a long period of time, or it's a lifetime disease. So in this chronic carrier we can say last for several years or for lifetime. Contact carriers, those who acquires pathogen from the patient, means by the contact with the patient he may acquire the pathogen. Paradoxical carrier, those who acquires pathogen from another carrier is known as paradoxical carrier. Now we will go to animal source. Infectious disease transmitted from animal to human are called zoonoses, or it may be called as zoonotic disease. Zoonotic disease may be bacterial, viral, fungal. For example, plague from rats, rabies from the dogs, and dermatophytes from cats and dogs. Insects. Disease transmitted by insects are called arthropod-borne disease. Blood-sucking insects transmit pathogen to humans, like mosquitoes, ticks, flies, etc. These insects that transmit disease are called vectors. In our plus one plus two also we had studied of the vector and carrier. Soil and water source. Some pathogens survive in soil for long periods. Example, tetanus bacillus spores. Water is contaminated by microorganisms like Vibrio, cholera, and hepatitis virus, and etc. Food source. Food contaminated due to improper storage or intake of already infected animal or plant products, means nothing but nowadays in every supermarket we are getting the preservative foods. In preservative foods many kinds of bacteria may develop in that, so it may cause an infection. Thank you friends, this is the end of our topic today. We had discussed about the definition of the infection, classification of the infection, and sources of the infection. If you like, please subscribe our channel, SRS channel, and if you want any kind of video regarding to the medical, you can comment below us. Thank you.